Welcome to the Pet Health series, brought to you by Tales of Tail. We are thrilled to embark on this journey with you, where we will explore the fascinating world of pet health and well-being. Let us understand first, what is hip dysplasia? Hip dysplasia is a condition where the hip joint doesn't develop properly, leading to joint instability and potential pain and mobility issues in us. While there is no natural cure for hip dysplasia, several management strategies and home remedies may help alleviate symptoms and improve our comfort. Hip dysplasia in us is primarily a genetic condition, meaning it is inherited from our parents. It occurs when there is a malformation of the hip joint during our growth and development, resulting in an improper fit of the ball and socket of the hip joint. The most significant factor in the development of hip dysplasia is genetics. Certain breeds have a higher predisposition to the condition, including larger and medium-sized breeds such as German Shepherds, Labrador Retrievers, Golden Retrievers, and Rottweilers. However, it can also affect smaller breeds and mixed-breed dogs. Rapid growth during a puppy's early development can increase the risk of hip dysplasia. Overfeeding and excessive weight gain during the first few months of life can put additional stress on developing joints. Poor nutrition or an imbalanced diet during puppyhood can lead to improper bone and joint development, increasing the likelihood of hip dysplasia. Here are some key nutritional considerations for dogs with hip dysplasia. Supplements containing glucosamine, chondroitin, and omega-3 fatty acids can support joint health and reduce joint discomfort. Turmeric contains curcumin, which has anti-inflammatory properties and may help manage joint pain and inflammation. Some pet owners use hemp or CBD oil as a complementary therapy to manage pain and discomfort in dogs with hip dysplasia. Activities that put significant strain on the hip joints, such as excessive running, jumping, or rough play on hard surfaces, can exacerbate the condition or lead to its early onset of hip dysplasia. As a precautionary measure, avoid high-impact activities like running and jumping, and instead, engage your dog in low-impact exercises like swimming or leash walking to keep them active without causing further strain on the hips. Being overweight or obese can put extra pressure on the hip joints, contributing to the development of hip dysplasia or worsening its symptoms. Maintaining a healthy weight is crucial for dogs with hip dysplasia. Weight reduction can help alleviate stress on the hip joints, reducing pain and inflammation. Environmental factors, such as the type of flooring a puppy spends most of its time on, for example, slippery surfaces, can influence the development of hip dysplasia. To prevent the same, supportive devices such as non-slippery carpets, orthopedic beds, ramps, and harnesses can help your dog move around with greater ease and minimize stress on the hips. There are some other treatment options that can help, like applying a warm compress to the affected area can help soothe sore muscles and alleviate discomfort. Some dog owners find that acupuncture provides pain relief and improves mobility in dogs with hip dysplasia. In severe cases, when conservative treatments are not effective, surgical options may be considered. These may include procedures like femoral head osteotomy, total hip replacement, or juvenile pubic symphysiodesis for young dogs. In some cases, stem cell therapy may be considered to promote tissue repair and reduce inflammation in the affected joint. Although genetics play a major role, environmental factors and lifestyle choices can also impact the severity and progression of hip dysplasia in susceptible dogs. Responsible breeding practices and regular veterinary checkups can help identify and manage the condition early, ensuring affected dogs receive appropriate care and support. It's essential to work with a reputable breeder who screens for hip dysplasia in their breeding dogs and follows best practices to reduce the risk of passing on this condition to future generations. Remember that while treatment can improve our comfort and mobility, hip dysplasia is a structural issue that cannot be completely cured without surgical intervention. The goal is to manage the condition effectively and enhance our quality of life. If you enjoyed watching our video, we would be incredibly grateful if you could show your support by hitting the like button, sharing it with your friends, and subscribing to our channel. Your engagement helps us create more exciting content like this in the future.